Hi everyone, thank you for joining us today. I'm Dr. Bita, this is Dr. Bales.
Hi.
So, how many of you out there forget your key? You're looking everywhere, then you realize, oh, it's in my pocket. Or you make a couple of appointments for one day, you don't realize. Or you forget names. So, we're going to talk about brain health and what to do to improve it basically and how to diagnose it. So there are different factors affecting our memory. We develop foggy brain. That could be infections like parasites can affect our brain. Dr. Biel will talk about F-scan later. It could be heavy metal can affecting our brain. Could be vitamin deficiencies. Could be metals like copper and lead. They oxidize. Like, how many of you out there use cast iron for cooking? Once a month, it's okay to use cast iron, but if you use it a few times a week, that cast iron, that iron goes into your food and you increase your iron in your diet. So iron is a double-edged sword. Too much of it is not good, too little of it is not good. Too much iron and copper, what happens to them? They oxidize and they produce free radicals. They are free radicals. So you need antioxidant to help you against them, or you want to lower them in your body because they can affect your brain. So they look at people's with Alzheimer's. You know, the beta amyloid plaques, they're made of copper and iron too. There's metals in them too, besides sugar complex and protein. So that's what we want to focus on, what to do to prevent it. Like if someone have the gene of Alzheimer, one of the ApoE4 gene, just one, you have 30% increased risk of Alzheimer. If you have both, it's like 10 times, 15 times that. But your gene is not your destiny. Just because you have the gene doesn't mean you're going to have it. I have genes of rheumatoid arthritis. Do I have it? No, because of my good lifestyle. At least I tried. So it's important to have a healthy lifestyle, to not activate the right and wrong genes, not turn them on. So there was studies done in Chicago. They look at people consuming a lot of high saturated fat. And the ones with highest saturated fat had more dementia, memory loss. It doesn't necessarily be Alzheimer. It could be mild dementia, just forgetfulness. And then in Norway, they did the similar study, but they look at the trans fat and they saw the same thing. So we know fat, saturated fat is not good, but at the same time, you don't want to bring your cholesterol down too far either because your brain is made of fat. So 20% of that cholesterol that made every day in your liver, it goes into your brain. So shrinking your brain, you're gonna cause dementia and memory loss. So going back to the metals, I was discussed the iron. You want to make sure the supplement you take doesn't have too much iron and copper in them. A lot of multivitamin may have added copper, added iron. Too much copper and iron is not good for our body. One of the way I check my patients is I do check their ferritin level. I do vitamin tests on them. A lot of doctors here do that to make sure we don't have too much copper, too much iron, or if we don't have too little either. Why is iron important? What does iron do? Carries oxygen to our tissue, to our body. Each iron molecule have 4 bonds of oxygen to it. So it carries oxygen to your tissues. So we want to have good amount of iron, but we don't want to have too much. So what is too much? Anything greater than 150 ferritin level is too high. Too little is less than 50. So I see a lot of women out there have less than 50. And it can cause depressed mood, can cause hair loss, cold extremities, changes on our nails. Another one is hormones. So when women get pregnant, that surge of progesterone and estrogen causes memory loss. Or when women get menopausal, too little of estrogen causes memory loss, forgetfulness. So you want to make sure your doctors check your hormones. Even testosterone plays a key role with with our brain. Mercury is important. So if you eat too much fish, like tuna, like swordfish, like halibut, like sea bass, all these good fishes, if you consume it more than twice a week, you're gonna have high mercury level. And that can affect your brain too and memory. And there was an article talking about aluminum being high linked with Alzheimer's. So aluminum, using aluminum foil, when you cook a chicken, you put aluminum, put it in the oven. That's not good. No. That aluminum leaks to your chicken. So simple stuff like that you could avoid. Exercise. If you exercise, what happens? Studies show that exercising can improve your memory, can increase your blood circulation, and can decrease risk of memory loss. So how much exercise? 40 minutes a week. So for someone who's hard for them to walk or jog, they could start doing brisk walk 10 minutes a day, go up to 20, slowly increase it, 40 minutes. But someone who's young, 25, 30-year-old, walk is not enough. You kind of want to jog. If your body is used to jogging, you want to keep that jogging 3 times a week, about 15 minutes each time. It doesn't have to be 20, 30 minutes of jogging. That's helpful. Stress. What does stress do? Elevate our cortisol level. And that can cause memory loss and dementia problem with the brain. And sleep deprivation. Simple as sleep. People have decreased sleep, interrupted sleep. Their brain doesn't function so well. So these are important key. And another thing you want to do is you want to up your greens, up your colorful vegetable and fruits, up in your berries, raspberry, blueberry. They don't have strawberry. They don't have high glycemic index. They don't elevate your sugar that high. So it's good to eat handful of blueberry, handful of raspberry, strawberries a day. That's good. And decrease your sugar. Too much sugar is toxic for our brain as well. So there are some supplement I make sure I take. One of them is omega-3. I think it's helpful for the brain. And if I go to conferences or if I have a speech, I take IQ Maximizer. That tend to make me focus. That helps too, temporarily to use those. They're all supplements like phosphatidylserine are good, phosphatidylcholine are good. People are taking it for their brain. But I think diet and exercise and sleep and stress are the key. So Dr. Bales is going to talk about some brain devices we have here.
Okay, so somewhat new, I have a device called Brain Gauge, and it is, I actually previously filmed a video for those who want to know in more detail, but in a nutshell, it's 40 years of research out of the University of North Carolina, and they were trying to develop a system by which they would know when a football player who had suffered a concussion was ready to go back to the field. So to traumatic brain injuries, cool. Obviously there's traumatic brain injuries. Yeah. So because the coaches and the player wanted to go back too soon, if they got another concussion on top of that concussion, it was it for their career. So they developed this, and it's about 25-minute test. It uses what looks like a little mouse right here. Want to see my mouse?
Yeah.
Okay.
Oh, very cool.
So it uses like a little mouse. Okay, it plugs into the USB port, and the software instructs the patient being tested to click as fast as they can when they feel a little vibration. There's 2 little buttons here. It has them do different patterns, and so it's able to map different properties of the brain as far as accuracy, speed, plasticity, fatigue. And it actually connects into a national database, so it can give a score based on that patient's age. So someone older is not being compared to somebody younger.
So that's excellent, because at urgent care, I would see a lot of patients with head trauma. And then we would evaluate them, say, okay, you shouldn't be reading or you shouldn't be watch TV because you had concussion, but this is more accurate to find out after any kind of head trauma if they're okay, correct?
Oh, absolutely. That's what it was originally for.
That's fantastic.
So here at Center for New Medicine, we've been using it kind of to develop or show a baseline of where someone stands. And then with the changes that Dr. Bita was discussing, perhaps in dietary, lifestyle, maybe get some more exercise, excuse me, we can rerun the test 6 months later and see the difference. So it's a great
Very
way to
cool.
know. I mean, it's always good to remember to know where your keys are, but if you see the computer, it's going to objectively tell you what's going on and if you've improved any. The other device I've had here for about over a year has to deal with parasites. As you mentioned, parasites can affect the brain, mental fog, fatigue, along those lines. So the F-scan is even shorter. It only takes a couple minutes, and it scans through a pretty large database, a couple thousand.
So it's a frequency. It measures our body's frequency.
Correct. It's putting frequencies out through a little cylinder that someone holds, and it's reading skin resistance on the opposite hand's finger, and it's able to put frequencies through and see if there's any resonant at a given frequency. Resonance is, going back to high school physics, is where the lady's singing breaking the glass. That's an idea of resonance used to destroy something. So it can go through it and track that, and actually comes up and says by name what the parasites, bacteria, viruses are, and then a resonant frequency.
It's an excellent scan. I have been using it for my patients.
Yeah.
Tend to tell about overgrowth of bacteria if they have parasite in them. It's very good.
Yeah, it's fast, and the results. And then again, just like with the brain gauge, one can rescan later to see if the parasites, bacteria. Most everybody that comes to see me, I'd say 95% have something. I mean, just living on Earth, we have something, but some people have a lot more. And also, if it doesn't come up with much, we can rule that out. Yeah. As far as maybe look at other factors affecting the brain. I would
say 60% of the patients that I send you to have that parasite. Yep. But the hard part with parasite is you can't just do a stool test and find out you have parasite, because parasites are stuck in your organ. They suck your nutrients. They cause anxiety. They produce these neurotoxin that causes brain fog, headache, can cause rashes in the body. It has such a vague symptom. Lupus. Yep. I have reverse lupus with getting rid of parasite. Some cases are more resistant. Some cases I seen good. Any kind of autoimmune, Hashimoto, all this stuff. So, and one thing we forgot, someone can have brain fog because they have low thyroid. Right. They go to their doctor, they say, I have this low thyroid. I know I do. I have weight gain, constipation, memory fog, but their numbers come normal. Their numbers on the lab come normal because sometimes it's functional. Functionally, you could check the patient's body temperature and know they're low thyroid, but the blood may look normal. But when you give a little bit of natural thyroid, they're going to feel so much better. So sometimes it's hard to just go with blood work. You do need to use these devices that we have at our office or tricks that we do. That it's good to diagnose people. And depression is another thing. Some people feel depressed, and that depression can cause foggy memory loss, or foggy brain. So I think...
just to add to that, I do have a treatment device which is called Firefly. And I do own the medical device company as a disclosure with my dad. We did a study back in Michigan. We ran 10 patients, 10 treatments each within a month, and their mini-mental scores improved by 35%. Wow. So we do have a treatment. Now that's not a substitute for changing lifestyle and doing everything you said. Yeah. It's a piece of the pie. Fun. It's an addition.
But what your device does is kills the whatever infection is going on in them, correct? How is it treating? Getting rid of
There's two ways. We can treat the gut with the information from the F-scan, but the trial back in Michigan was actually just using it right on the cranium with no frequency. So just to increase blood circulation. And coming soon here, we're going to have a helmet with infrared and red light from Weber from Germany. Yeah. That people can buy, or maybe we'll do a rental program for people to take so they can have at-home therapy.
That's great.
So between my therapy and that, I think that would help a lot. Not a substitute for what you did, but just in addition to. Yeah.
So what you do, those devices increase the blood flow and circulation. Right. That's why it improves the memory and the brain. Thank you for joining us today.
Thank you.
Hopefully it was helpful for you.
Have a great day. Bye.